Hello and welcome to another episode of your show, Medical Talk at Desmond Diabetes Institute. I'm Dr. Mohammed Al-Mahtab. A new episode highlighting the great efforts of Desmond Diabetes Institute and all the dedicated departments and exceptional team of experts who are committed to advancing diabetes treatments and prevention. In this episode, we will be discussing the important topic of diabetic neuropathy, which are a food problem related to diabetes, their causes, symptoms, and the latest treatment options. In this episode, I will be joined by Alice Cusworth, a chief podiatrist at Desmond Diabetes Institute, to answer as much questions as we can about diabetes, food problems, right after this break. Diabetes is a chronic condition that affects the body's ability to regulate blood sugar levels, requiring careful management to prevent complications. Proper care and consistent monitoring of blood sugar levels is crucial for those living with diabetes to prevent other related health issues, especially issues related to the patient's feet. Food problems are common in people with diabetes. They can happen over time when high blood sugar damages the nerves and blood vessels in the feet. The nerve damage, called diabetic neuropathy, can cause numbness, tingling, pain, or loss of feelings in your feet. If you can't feel pain, you may not know when you have a cut, blisters, or open sores on your foot. A wound like that could get infected. The infection may not heal well because the damaged blood vessels can cause poor blood flow in your feet. To know more about diabetes-related food problems, we're happy to have with us in the studio Ms. Alice Cusworth, a chief podiatrist at Desmond Diabetes Institute. Welcome to Medical Talk.
Salam, thank you for having me this afternoon.
Thank you so much. I am very interested to know personally about your job. So can you explain to me first, and also to our viewers, what do you do?
So podiatry is a branch of medicine. It's quite an unknown branch as well. And we specialise in the study, diagnosis and treatment of the lower limb and feet. And within that you can go into specialise in paediatrics, vascular, sports, and in this case, diabetes.
Nice.
There's only a few podiatrists within Kuwait. We're quite sought after. And in the worldwide, there's also a shortage, and this is having more of an impact as more people are living longer and more people are being diagnosed with diabetes year on year. So we're seeing a shortage of access to service.
That's quite interesting. So you are specialized in feet, basically.
Yes.
I guess my next question is, how is that linked to diabetes in terms of management, and also how does that basically affect the patient's feet?
Yes, so the longer you've had diabetes, or if your diabetes has been uncontrolled for some time, it can have a knock-on effect with having a reduction in blood flow to your feet. You can develop a problem called neuropathy, where you start to lose the feeling in your feet, which can become dangerous if you don't realise that you've got an injury to your feet and you carry on walking with it. And you can start to have foot shape changes, and this can change pressure in your feet, and you can get some high pressure points. these problems can lead to an increase in the chances of developing a foot ulcer or a wound. These can take quite a long time to heal up, and if the wound doesn't heal, you can lead you down to a route of amputation, and this could be a minor amputation or a major amputation. So here at Dasmin, we're really trying to work on the preventative and education with patients to improve patient outcomes.
Exactly. We're going to talk about the education part in a bit, but I want to ask you, because presumably some patients, they don't even know they have diabetes. And sometimes, there are some early signs and symptoms that they might be aware of to go and check it out. So what are the early signs and symptoms that a patient could see specifically on their feet?
So one would be that their foot shape is changing. The toes might be becoming retracted and they're getting a higher arched foot. Patients with diabetes, their skin tends to dry out. And no matter how much cream they're putting on, they're just not winning the battle with that. Patients might be more thirsty and they might start to get a burning sensation in their feet, especially at night time, and this can be an indicator that they're suffering with diabetes.
Exactly, because the reason I ask you this is because is it possible that someone or some patient may come to you when it's too late and they didn't even know that they had diabetes?
Yes, an example of this, last week I was referred a patient from a nurse who did foot screening. This was their first appointment. They had no idea that what risk category they were in. We classified them as a high-risk patient. They'd lost complete sensation in their feet. And they had a blocked artery in one of their legs, and they also had a wound present. And for them to get to this stage, there should have been some warning signs along the way, but with the lack of feeling in their feet, they hadn't realised.
Okay. So specifically here in Kuwait, what is the most common problems that you see in your clinic?
Okay, so here we have a lot of patients coming in with quite minor ailments, and this could be dry skin, and again with diabetes, your skin tends to dry out and you need to be putting more foot cream on than would normally be necessary to improve the skin integrity. Patients coming in with fungal infections, especially between the toes, and this can increase the chance of developing a foot infection if you're washing your feet up to 5 times a day and not drying between the toes properly. And these are quite minor ailments, but they can escalate quickly. And some patients also present with pain in the backs of their legs, and this can be due to a lack of circulation or poor blood supply in the feet, as well as having pain in their feet at night time, sort of a burning or electric shock type pains, and this happens when the sugar levels are high and unregulated, and it can have an effect on the amount that patients are able to sleep, so it has a knock-on quality of life.
Absolutely. So my next question is it's a two-part question. Given that the pain sensation, the burning sensation that my experience, is it possible the patient might neglect this or maybe misdiagnose this as gout, for example, but it's not gout, okay? And the other part is, what are you looking for when you do your assessment initially?
Yes, so the painful sensations in their feet can be
and the burning
in
yeah,
their feet. We often have to try and exclude other health problems, or it could be down to a vitamin deficiency, or it could be due to a trapped nerve in the back. So sometimes we have to try and exclude everything before we pinpoint it that it's down to diabetes. But when patients are coming into clinic, we are starting off with taking a medical history, looking at lifestyle factors, and this looking into whether they smoke, how much exercise they're doing, blood pressure, cholesterol, their blood sugar levels and how well controlled they are. And then we're moving on to assessing the skin and nails, and if there's any problems there, as well as deformity. And then we will then start to look at their blood supply to their feet, and if there's any issues there, and we're using an ultrasound to assess this. And then we'll be also looking at the nerves supplying their feet, and if there's any loss of protective sensation. and then we'll finally be assessing footwear, which
it's quite journey.
can be a bit of a battle with trying to get our
Yeah.
patients into the right footwear,
Yeah.
especially if they've lost the feeling in their feet. They think their shoes are fine, but really they're not suitable for their foot shape.
And you do all that in Dasman Diabetes Institute?
Yes, we do.
Yes.
We try and carry this out in a 40-minute appointment.
Yeah.
So we're really moving through things quite quickly, and we're also relying on information from the other healthcare professionals within here. We're sharing notes and really communicating with them.
That's good. We'll have more questions, but we have to take a short break. We'll be right back. Stay with us. Welcome back. We're still talking to Alice Cusworth, Chief Podiatrist at the Dasman Diabetes Institute. Alice, before the break, we were talking about the diabetes foot problem in general and how to assess them, to do any assessment for them, and what you're looking for. Now, I want to ask you about the long-term effect if things got neglected and patient decide not to come for treatment. What the possible long-term effect for that condition?
Yeah, so often we see patients that haven't been assessed for some time, or they haven't been controlling their diabetes. And with that, they've neglected their cholesterol, their blood pressure, their blood sugar levels. And this all has a knock-on effect on the feet. So they've started to lose the feeling in their feet. They've lost the protective sensation. So if they have an injury, carry on walking on it, which causes further damage. As well as having circulation issues, poor blood flow to their feet, and also a change in their foot shape. These together can cause a foot wound, and these take a long time to heal up, which could result in an infection, or it can lead to an amputation. And either of these, having a wound or an amputation, has a real effect on your lifestyle and quality of life, but not only your lifestyle, family members' lifestyle as well. If you're having to attend multiple appointments, or if you're needing extra care and input, it can really become a bit of a burden.
Absolutely, yeah. And now I want to ask you about, do you do any basically collaboration with vascular department? Because
yes, we do. Yeah, every week we're referring several patients off after we've completed ultrasound and we've taken ankle and toe pressures. If they're out of our normal range, we will be referring them to vascular so we can have a more further investigation completed. And this might be looking for a blockage or hardening in the arteries so that we can intervene sooner rather than later. Traditionally, we used to leave it until a patient had a wound and then we end up firefighting, but we want to really intervene, and patients can have procedures to open up the blood vessels, and then they'll have a lot better outcome.
Exactly. Now, speaking about like the time frame for the treatment, for the viewers to know what to expect, basically. So, how long this basically journey takes from the moment they see you until that? Is it a continuous process? Do they have a follow-up?
Yeah,
Usually...
so every patient should be seen at least once a year. That's if they're low risk. If they're deemed to be moderate risk, it's every 6 months. And if they're high risk, every 2-3 months. But it could become weekly or a couple of times a week if they have a wound. So we're really gauging it from case to case. But every patient should have an assessment with a medical professional at least once a year.
Okay. In your experience, who's more prone to having diabetes foot problems? Is it males or females?
It's 50-50 on that, but I find women tend to take care of their feet a bit better than the men and tend to wear more enclosed and protective footwear. Especially here, I find men are just slipping on sandals and they haven't got the protection to their feet.
That's a professional opinion or a biased opinion?
Yeah, probably biased, but what I'm seeing in my clinics, yeah, it's not based on any research.
But it's a fact. What's based on what you're seeing, basically. All right. I want to ask you about kids. Are kids also vulnerable for condition, or are they?
Very rarely related with their feet to their diabetes, because it takes quite a while for uncontrolled diabetes to manifest in the feet. But if the diabetes is uncontrolled in type 1, getting into the 20s and 30s, we can start to see signs.
Because the word kids, I mean, it's quite broad, because we're talking about maybe like adolescents when they are like maybe like 16, they're obese and overweight and they're not taking care of their feet.
Yeah, with at that age group, we tend to see quite sweaty feet as you go through their teenage years. So
Exactly.
they're not suffering with the dry skin, but they might start to notice tingling in their feet or loss of sensation.
Exactly. Now, I want to ask you about what advice do you give for choosing footwear, especially here in Kuwait during the summertime?
Yeah, so when choosing your footwear, I would say go out in the afternoons, especially if your feet are prone to swelling, so that your shoes that you buy will accommodate that extra space that you need. Ideally, you need to have about a finger width between the longest toe and the end of the shoe. And your shoe should have a fastening such as laces or Velcro to stop any movement of your foot, which can result in blisters. And our feet take a lot of pressure and shock throughout the day, so we need to have enough cushioning and support to allow for that. And we want to have a thick sole for protection.
Exactly.
Underneath the shoe.
High heels?
No.
No.
High heels and holidays. I would
Exactly.
say.
No,
Yeah.
because I guess that's a common question, you know.
It is, and we do have a lot of
yeah.
patients coming in with heels, but it just adds to the pressure on the forefoot, which can then lead to bony prominences underneath your foot.
Exactly.
So you want to try and minimise that by wearing nice, comfortable shoes. Something like a trainer is ideal.
Here in Kuwait, we wear lots of sandals.
Yes.
So is that a problem?
It is. Towards the end of the summer, we have patients coming in complaining that they've got muscle aches underneath their foot. And this is where they've opted for a more minimalist shoe, perhaps to keep their feet cooler during the summer. And often end up with these aches and pains, and we have to prescribe them a series of stretching and exercises to try and stretch out their calves again, or perhaps wearing an insole and more supportive footwear.
All right. We got more to talk about. We're going to have to take a short break. Do stay with us. We'll be right back. Welcome back. We're still talking to Alice Cusworth, a chief podiatrist at the Desmond Diabetes Institute. Alice, before the break, we were talking about the footwear options that we have in Kuwait, especially in the summer season, right now. I want you to give our viewers like a general advice on how basically to take care of their feet, not just for the summer, for the whole year.
Yeah, so every day, patients with diabetes should be checking their feet every day for any breaks in the skin, cuts, bruises, nail problems. Feet should be washed at least just once a day, and make sure that you dry thoroughly between the toes, and this can help minimise the chances of getting a fungal infection. You also need to change your socks every day. And when it comes to nail cutting, just cut straight across your nail. Don't cut down the sides, which can encourage an ingrown toenail. And it's really important that if you have diabetes, that you don't walk around barefoot. And this includes inside the house, which surprises some people. But if you can try and wear slippers in the house, it will just help with the protection of your feet.
Exactly. And for those who are without diabetes, do they follow the same protocol, basically, the same advices, or do they need to see a podiatrist even though they're not, you know, a diabetic patient?
Yeah, I'm probably biased, and I would say everybody can do with just having a review every now and then. Yeah, screening of their feet.
I agree. I think everybody should do it.
Yeah, it's definitely to check out the skin integrity and if there's any improvements that you can do to your routine.
Okay. You know, there are some people who advocate using moisturizers also for the feet as well. Do you recommend that?
Yes, so every day patients should be using moisturizer on their feet, all over their feet, but not between the toes. And this can help with the skin elasticity and improve the quality.
Exactly. Here in a predominantly Muslim country, because they do the ablution, they wash their feet 5 times a day. That's very important, I think. I don't know if you agree with me, that they need to make sure that they dry their feet.
Yeah, this is paramount, that you're
Yes.
dry between your toes, especially because it can encourage a fungal infection with the moist environment.
Absolutely. Let's talk about the future. What's the future is holding for us in the field of podiatrists, basically?
I think within podiatry,
Yeah,
we're only going to see more patients coming our way, especially as we're becoming more of a prominent member of the multidisciplinary team. We're getting more referrals from other healthcare professionals, more people are being diagnosed with diabetes, and all of these people need to be screened yearly. And with this, we'll be diagnosing more foot problems as people are living longer with diabetes. So it's going to be a busy time ahead as a podiatrist, and hopefully we'll be able to recruit more podiatrists and train them up.
In terms of your advice and collaboration with shoe factories, basically, I'm sure they're keen to know your input, especially the big companies. They're keen to know your input regarding how to design the perfect shoe or sandal for a patient. Do you wish for something that happens now, that you wish that all the companies that need to follow?
Yeah, and I think also within the stores, they should be measuring feet. It seemed to be, when I was a child, you'd always go to get your foot measured,
Yes.
and you'd have your shoes fitted properly.
Yes.
And this seems to be lost nowadays. You almost go to a shelf and you pick out the shoes and try them on yourself. Whereas if you've lost the feeling in your feet, you haven't really got much of a guide to go by. So I would say the service needs to improve in shoe shops so that customers are wearing the right footwear, and also the design of them needs to be diabetes friendly, with the soft and protective insoles, but also seamless on the inside of the shoes to prevent friction.
Okay, I promised you before the break that we're going to talk about the education parts. So can you, before we close, in 2 minutes, you explain to us what's the educational part that we have here at Desmond?
Yeah, so after we've completed our thorough assessment with patients, we're really going to town with the education. And my Arabic is shway shway, so I have a translator who can really get the message to the patient. And as well as giving verbal advice, we are doing written information as well. There's also information on the Dasman website, and we also put out social media posts on Instagram and Facebook. And we also have a WhatsApp number that patients are able to text, and they're able to ask me a question. Just this morning, I had a patient sending in a photo of his toe, and he just wanted some advice. So the message that we're sending to the patients is to act early, come and get our opinion. I would rather a patient comes in and there's no problem than they leave it and wait until their next appointment. So there's a lot of information out there for the patients, both verbally, written, online. So there's no excuses.
Well, we all appreciate your fine work here at Desmond. Thank you so much for your time and for all the valuable information that you shared with us. And we wish you good luck.
Oh, thank you.
Thank you.
Shukran.
Dear viewers, we still have more to go, and we will be right back. Stay with us.
Hi, myself Shresh Chandra, Specialized Fitness Instructor at Dasman Diabetic Institute. Today our topic is tennis elbow. What is tennis elbow? Tennis elbow is a condition where the soft tissue which is located in the elbow will get inflamed. What causes it? Extensive use of your muscles or overload will cause it. At times even direct blow to the elbow will give that. So there are two phases in tennis elbow. First one is acute phase and second one is chronic phase. In acute phase the pain is immense. So it is always advised to take some cold packs where you have pain. It will subside the inflammation, thereby you will get pain relief. Second thing, the muscles which are tight have to become free. So for that you have to release the muscle, thereby the muscle length will increase, even the load on the origin will get reduce, thereby you will get reduction of pain. In chronic phase, it is always advised to take some painkillers based upon your doctor's advice and splints, which will give you an additional support for your condition. And after that, once your pain starts subsiding, even you can take physiotherapy for reduction of pain. After that, you can start doing exercises which will be instructed now. So what are the signs and symptoms? The main complaint is pain in the elbow, grip strength will be weak, extension of wrist will be painful, aerial activities like driving a car, opening a bottle will be painful. Management. There are two stages, acute phase and recovery phase. Acute phase, it is always advised to take some cold packs initially, but never apply this cold pack directly onto the skin. It is always advised to wrap it in a towel, then place it in the place where you have pain. You can keep it for 5 to 10 minutes for 3 to 4 times in a day. What are signs and symptoms? Patient will complain of pain in the elbow, extension of wrist will be painful, grip strength will be reduced, opening a bottle even will be painful, any twisting activities will be painful. Even activities like aerial activities like driving a car, opening a bottle and screwdriver fixing anything will be painful. So what is the management? There are two phases. One is acute phase and second one is recovery phase. In acute phase, it is always advisable to apply some cold packs. So this is a cold pack, but never apply this cold pack directly onto the skin because you may have some chances to burn your skin. So it is always advisable to wrap it in a towel, then place it on the elbow where you have pain. You can keep it for 5 to 10 minutes for 2 to 3 times in a day. The second one, you have to release the tissue which is in and around the joints. For that, you have to do soft tissue release. With your 2 fingers, place it near the elbow on the soft tissue and do gentle circular movements. And with this thumb and index finger, you can hold the muscle and you can slide it medially and laterally. This is what you should do in the acute phase. Recovery phase. This is the phase where you should concentrate to strengthen your muscles. First thing what you should do is start with a less weight dumbbell, or even what you can do if you don't have a dumbbell, take a water bottle, fill it with water or even with sand. Hold it, but remember the bottle size should not be too big enough to hold it. It should be as minimal as possible. Hold it. First place your hand on a table or even on a chair in such a way that your wrist should be hanging down. Take the dumbbell. Now extend your wrist as much as possible and hold in that position for 1 to 2 seconds, then take it down. Repeat this for 10 counts. 2, 3, like this you have to do for 10 counts. You can do this for 2 to 3 times in a day initially. And third one, to improve your grip strength, you can take a ball which is soft and which is advisable. Soft is the one which we advise. Hold it, press, hold it for 2 seconds, then release. Press, hold for 2 seconds, then release. And the last one is stretching exercise. Take your shoulder into 90 degrees flexion, elbows full extension, wrist flexion, and gently with the other hand take your wrist into flexion. Hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then relax. Repeat this for 3 to 4 times in one set. So you should do 2 to 3 times in a day. Thank you.
Well, that's it for our show today. Hope you enjoyed it. Until we see you again, please stay safe and stay healthy.